So what's the link between pain and trauma? And what does this have to do with the likelihood of becoming addicted to things like painkillers? So somebody asked me this question in my DMs the other day, and it is incredibly good. So let me explain it for you from a drug scientist perspective. Now, before we begin, we have to get on the same page about things like definitions, because y'all just use the word trauma to mean basically anything. And when I say y'all, I'm not talking about like TikTok people specifically, I'm talking about the entire world. Like in 2/3 of the papers for this review that I read, they didn't even list what trauma meant. So what I'm referring to here is early life trauma, which is basically any general mental, physical, emotional, sexual events that may have altered your development, that may have caused trauma. Now, notice that I say may have altered development and may have caused trauma. It is not necessarily a thing that causes trauma in everybody. It is a thing that could potentially alter your development. We don't know for sure if it did. These are typically measured in ACEs, which is the adverse childhood experiences. So typically it's a scale of like 10 different things where they're like, how many of these did you experience? See, there's a whole bunch of scales available. But in general, they're asking questions about things like, did you lose a parent due to things like divorce? Did you experience any sort of physical abuse when you were younger? Did you live in a home environment in which you felt dirty or didn't feel like you had your needs met? Did you feel like nobody loved you when you were young? All of those count as ACEs. We see that about 62% of adults reported having at least one traumatic event in their childhood. And we see that about a quarter of people had 3 or more. And the more of these you had, the more likely you are to be addicted to any sort of substance. So literally, like if you had one, you're at higher risk, but then when you keep adding them up, you keep getting it at higher risk. Now, none of these risks add up to 100%. So there's never a guarantee that like if you have 10 out of 10 of the ACEs, that means that you are going to become addicted. It does not work that way, but more that you have, greater the risk. So we see that this pattern holds out for opioids too, but it might actually be a little bit worse for things like opioids. Why? There's a whole bunch of different reasons, and I'm going to get into some of them, but let's talk about what we know for sure. So the earliest studies were typically the animal studies. And what the animal studies were showing is that basically like if you give early life stressors to rats, this leads them to be basically more sensitive to opioids. So they actually found things like morphine more reinforced. And when I say early life stressors, I mean early life stressors. Like we're talking about pups whose mothers had been exposed to stress. They were more likely to like the effects of morphine too. Like before they even came out of the womb, they were at greater risk for things like addiction. And specifically, it seems like this is linked to mu opioid drugs. So this is seen for other drugs as well, but it seems like mu opioid receptor drugs, so those are things like H and phen and oxy and morphine, all of those were particularly sensitive for rats who had higher levels of early life stressors. Now, what do we see with humans? Well, something kind of similar. Yeah, people who had opioid use disorder had higher levels of ACEs during their childhood, and like somewhat disturbing levels. So we're talking about 42% of people who had opioid use disorder had reported sexual abuse during their early childhood. And that is compared to about 11% of the people who did not have opioid use disorder, almost 4 times more. Not only were they more likely to become addicted, they were more likely to use at earlier ages. They were more likely to transition from just misusing, so just taking prescription painkillers when you're not supposed to be, to actually becoming addicted to them, as well as starting to use in the injection route versus other routes of administration. And all of those things are linked to addiction. Like, why? What is actually going on here? Well, first, it seems like there might be this link specifically with opioids. So people with early life trauma were actually more likely to have both a pain-related disability and just chronic pain in their future in general. And we do see that the more ACEs somebody had, the more likely they are to just use pain meds in general. And this is specifically pain meds. So we are seeing both over-the-counter pain medication as well as opioid pain medication too. Now for things like benzos, not as much, but for things like those mu opioid receptors, yeah, higher rates. There are so many links here between pain and addiction to opioids that we need to start exploring because we don't know why that relationship exists. So it could be that like maybe they're less sensitive to pain. Maybe they're just more likely to have chronic pain. Maybe their chronic pain is more likely to be severe. Maybe they are more likely to go get treatment. We're not entirely sure, but there is this strong link here. And we see that it might have something to do with like actual brain development too. So what we see is that in animal studies and human studies, there is this link between things like adverse childhood experiences and later sensitivity to the dopamine and opioid system. So what we see is that early life experiences are linked to a decreased activation of the opioid system and a decreased activation of the dopamine system, which might lead to things like opioid addiction. You're actually kind of finding those drugs more reinforcing, and in general, things are not as reinforcing to you, so you might be self-medicating with drugs more. Now, intriguingly, nobody's actually done the studies looking at things like whether ACEs actually make somebody more or less sensitive to pain in general. Like, there's not much out there on that. And this was a review from 2025 that was like, yeah, we need to start looking into that more. So that is a definite avenue that us researchers should be going down. We also see that the brains of people with ACEs are potentially just more sensitive to the reinforcing effects of opioids in general. So they might be self-medicating, they might be more sensitive to opioids. They also could be kind of like coping with stress or dealing with like some of the emotional regulation problems that they might have due to the ACEs with the drug. So we see that, yeah, the more ACEs you have, the more likely you are to have emotional dysregulation. So you don't necessarily know how to deal with stress. You don't necessarily know how to cope. You don't know how to deal with emotions as well. And so therefore, you're more likely to kind of cope with things like drugs. You might be more sensitive to risk-taking in general too if you have more ACEs, although that might make you more susceptible to kind of all drugs in general, not specifically opioids. Now, you might be listening to this and be like, cool, I have so many different ACEs, and yeah, I have a surgery coming up and I'm going to start having to take prescription painkillers. Like, what does this mean for you? Well, the thing that I want you to understand is that this is not destiny. As like I said, having a 10 out of 10 score on ACEs means that I'm sorry your childhood was so terrible. That sounds horrific. But you're not guaranteed to become addicted. Never take this as a guarantee. Think of it more as like I might be more prone to this, so I should watch out for some of these symptoms. And maybe think about how to deal with some of those things that might be problematic that might have come about from the ACEs. So for things like emotional regulation or stress coping, we have skills that we can set you up with to help with that. Like, we have specific trauma-informed therapists who are supposed to help you with things like ACEs. Take advantage of the resources that are out there and recognize that you can do things to help lower the risk too. Even though you might have been set up in a bad situation, that doesn't mean that you are guaranteed to have a lifelong problem that you have no say in. But also, let's recognize that some people might be more susceptible to these types of things and stop having a stigma against people who do become addicted to opioids, because they are just as human as the rest of us. And whether they're using opioids because they're in pain, which could be linked to ACEs, or they just need to cope with something, which also could be linked to ACEs, it doesn't matter. Let's just get help to the people who need help.